It's more on the community perspective, and I know you're doing this, but maybe it would be valuable for people to hear. Many people are hired here at basic level positions and then given free education so that they can contribute more and more to the hospital. And I know we have had nurses and other people who have grown here. And I'd just love to hear, you know, what you're up to right now to help people from the community to get a career.
It's true. Even where those kind of cutbacks have been made in other institutions, we have continued to offer assistance with continuing education in the health-related fields. We maintain that and feel very strongly about that. We could have in any given moment, if you popped in on any given day, probably 3 or 4 staff members that could testify to having started as maybe working in the kitchen or a CNA and are now RNs or LPNs. And those very same people, studies have shown, it certainly has borne out here, stay here. They're happy, they're grateful, they feel invested, they feel that they've been supported, and they remain. So while other hospitals and nursing homes struggle with a greater difficulty in maintaining staff, we haven't been hit nearly as badly with that. And I think that's one of the many factors involved.
I have 2 nurses right now that just completed their bachelor's, and they are already enrolled in the nurse practitioner program out of our ED, so that's really wonderful.
Anything else?
Just a general question for both Sandy and Philip. What sort of challenges or opportunities do you see coming up that you're gearing up for in the next year or whatever?
Well, a couple of the things that I'd like to do, I know we're going to be upgrading our, thanks to the Rural Health Grant, we're going to be upgrading all of our endo equipment to digital, which will really be state-of-the-art. So I'm hoping that will happen, you know, within the next few months. And we have on the table, we would love to be working, we have put in our capital budget to try to upgrade the old ED area and make it part of radiology, to expand that and maybe move the bone density in there and the mammograms. So those are 2 big things that we'd really like to get done in the hopefully by the year end.
For us, I would say that
I'm sorry.
Electronic health.
Oh, the EMR, absolutely. That's coming out, that'll be out in May of 2013. And we started work on that right now. In fact, this was the first week. We have representatives from all the departments that have to go down to Kingston to build the new program. And it's called Paragon, and it's with McKesson. And that will be a phenomenally wonderful thing, because we'll be able to communicate not only with Kingston, every department will be able to communicate. We'll be totally electronic. So that'll be wonderful.
Can you
really
explain
wonderful.
what EMR stands for?
Electronic medical
Why
record.
it's important.
Yes. Electronic medical record.
And why it's important?
Because everyone is moving toward that right now, and it is the only way that you won't have to ask the patient. For example, a very silly little thing that we do that is very frustrating to patients. Every single time you come, we have to ask you the same question maybe 5 times. This way, everything will be electronic. It'll be saved. We will update all the questions when you come in, but you won't be asked the same question in the ED and acute and every department that you go to. And all the physicians will be able to access, each department will be able to access. So it's just the right way to go.
I would add for Mountainside's challenges,
already.
we have an electronic medical record, and it's part of, I'll speak to that first. And having an electronic medical record not only makes the patient and resident experience nicer, as Sandy was saying, but it allows you to instantly collect data and run various reports at a level you couldn't possibly do before paging through multiple paper charts, where you can run QA reports if you're looking for the frequency you use a particular medication, or the documentation of a particular physician or nurse, or how many pressure ulcers on what days and what shifts, and if you're really trying to boil down to some granular issues, you can do it at the touch of a button, and it can raise the efficiency and quality of your programs immensely. I know it's been a big part of our QA program here.
And it also won't allow the nurse, for example, in charting to move on if she hasn't answered the question that needs to be answered about the patient. It gives you prompts. So it leads to better care.
And it's one of the things that you mentioned, the things that we're working for here is we want to continue to become as high-tech as possible. And there's already Wi-Fi throughout the building that the residents can access. More and more of the folks coming in are computer savvy now and have setups that put mine at home to shame right up in their room. We want to be able to continue to offer that. We have recently, through the foundation, purchased an iPad, and we're looking for opportunities. There's vast amounts of applications and technology available for this population, for cognitive stimulation, for range of motion, for therapeutic leisure exercises and things like that. So we're tapping into that. And the other thing we're going to continue to do is we're steeped in the person-centered care movement, which essentially in a nutshell is de-institutionalizing institutional nursing homes, making the setting as home-like as possible while meeting the incredibly burdensome regulations that exist in long-term care. So it's a balance, but it's fun, and that's what we'll continue working at.
Marty?
Yes, I'm wondering if you're facing any significant financial issues going forward, or is everything hunky-dory, or where do we stand with respect to that?
Well, speaking on the nursing home level, no, I mean, there's not. I don't think you could pick out any aspect of healthcare in the United States that's hunky-dory. We're faced with cutbacks at every angle. We're faced with becoming more efficient at every angle. As far as this campus, and Sandy can speak more directly, we've been managing to walk that tightrope pretty well. Would we benefit from a rosier financial picture at this point? Of course. Are we in danger of closing our doors tomorrow? Not even close.
No, and we're the same. We're making budget every month, which is very positive. We have to be fiscally responsible though, and that's what we do. Like if the census is down, we flex staff, and staff have been very cooperative about helping with that. What that means is, if I have less patients, some of the staff might take a vacation day or go home. So, but on the whole, I think we've been very successful. Very successful.
Yeah, I mean, you mentioned a lot of sophisticated equipment
Yes.
that you now have. I mean, and that's expensive, and I know you need to have
On the
a
other
lot
hand,
of people using it to make it.
It's allowed us to become more efficient in certain areas. Through attrition, when we first got our EMR, we had 3 or 4 unit clerks at any given time, and there was a lot more time spent and hours paid doing paperwork. And that's not the case anymore. We're able to run much more efficiently and with better quality outcomes, which also leads to less overtime, which also leads to no fines from deficiencies that you got because you didn't have that level of quality. So there is some payback at the other end. Sometimes getting the money up front requires some creativity, assist from the foundation, grants, etc. But
And we've been very fortunate to have good grants, and we go for every grant that we can get to help pay for the equipment that we have to get.